All right, good morning, everybody. Looks like we've got a really great group here. I know other people will start joining and keep joining. So welcome to this educational forum. This is a collaboration between the All Children Thrive Project, NACCHO, and BARHII. And you'll hear from representatives from each of those programs a little bit about what we do. And we'll present some strategies on how we're working together on housing policy. So I'm Katie Speziali with Public Health Advocates.
Sure.
Yes, hi, thanks. If you could just mute yourself during this part, that'd be great, just so we can cut down on the noise for others. But again, I'm Katie Speziali. I'm one of the program managers with the All Children Thrive Project. I'm going to go first and explain a little bit about our All Children Thrive program. We're presenting this webinar as a series in our educational forums that we're holding for cities. So I'm going to go ahead and share my screen and explain a little bit about ACT. Okay, so All Children Thrive, also known as ACT, is a program funded by the Mental Health Services Act here in California. From the state level funds. We're working with cities across California to build networks of people who want to transform systems that are shaping child well-being. And we're doing that through working with the city leadership structure and communities together to figure out issues that are salient for each city and that community would like to work on with city leadership. So it's a little bit different than some projects who are working with county level public health. And the reason for working with city officials is about thinking about policy in terms of that transforming the lives of kids and families and thinking about how policy is related to prevention. So we're co-designing those solutions, and we're also thinking about healing some of these adversities, or you may have heard of adverse childhood experiences. And so we're addressing that, but from a prevention standpoint. So we're going to explain a little bit, what does this mean really for our communities? Well, practically, it means that we're working with cities across California on one of these community action areas. And you'll notice that we have more than, but one of them is access to safe and stable housing, followed by creating protective environments, promoting healthy childhood development, strengthening economic supports, mental health and well-being, and youth development and civic engagement. And I should mention that each city has the involvement of a youth design team, which represents the city's youth, and sometimes those youth actually sit directly on the policy committee. And so the access to safe and stable housing was an issue that we really wanted to explore long before this webinar, but with the advent of the global pandemic, definitely, disparities have been exacerbated, and we really wanted to explore this with you all today because we think it's a really important issue. So this is a list of some of the policy solutions that we're exploring with All Children Thrive cities. And you're going to hear some of these today from Will in terms of how this actually looks on the ground. And so this list is developed from our policy platform, which is a list of policies that have actually either been tried and demonstrated to be successful, or been tried and produced lessons learned for the field. And so in this session, as I mentioned, with the pandemic and sort of the uprising around racial inequities this year, those disparities that we know about in public health and probably from a city leadership standpoint have just been exacerbated. And so we think that that's a result of neglected prevention, and that policy has a role in prevention. So given that many families are struggling. As we know, we want to sort of explore today the role of housing policy in providing safe and stable lives for families. And we also just want to explore some of the issues, and will go over this really well, that families are facing in terms of finding and maintaining stable housing. And so, as I mentioned, we're working with over 60 cities in California already on local projects that include some of those community action areas, and also including access to safe and stable housing. So if you're interested in joining us, or even just talking to us about what that might look like in your city, we would love to meet with you and love to discuss what that would look like. So here are 2 ways that you can get a hold of us. There's an email there and a website. Also, you can just put your name and your email in the chat, and we will reach out to you with that information. And I also want to introduce Jeffrey from NACCHO. He's going to explain a little bit about what they do and their role in today's educational forum.
Thank you, Katie. Just for the slides to jump back on the screen for us. All right. And so if we just go to the next slide, we'll just have this on the screen. But first, I just want to thank everyone for joining today, joining this webinar. We're very excited for this webinar. We hope that it's going to be powerful for you as you pursue the work that you do out in the field within public health. And just really hope that you gain a lot from your experience today. And so really what I want to do is just introduce myself and NACCHO to you all. So again, my name is Jeff Wangulu. I'm the Director of Public Health Law and Policy over at NACCHO. And we are putting on this series in collaboration with ACT California and BARHII as part of a series of webinars that we've put together for local health departments as they address the COVID-19 pandemic within their jurisdictions. This webinar series is supported by the CDC, and we hope to, at least through this series, help local health departments and public health in general really support their workforces as they address public health issues related to the pandemic. And so really want to emphasize the fact that as part of this series, there have been actually three previous webinars that have taken place related to this series. If you would like to have access to those recordings related to topics such as the protection of frontline workers, as well as congregate care settings and responding to congregate care settings, please feel free to access NACCHO University. You could Google NACCHO University, or you could go to the website pathlms.com/NACCHO, NACCHO, and you should be able to find the recordings on that website fairly easily. And so who is NACCHO, for those who aren't aware of us? And just want to note that if you are on the line, unmuted, please mute your lines. Thank you. All right, and so NACCHO is a National Association of County and City Health Officials. We are a member organization for the nearly 3,000 local health departments across the country. We hope to serve our members by being a leader, partner, catalyst, and voice for those local health departments. If we could jump to the next slide, please. Now, in terms of what NACCHO does, we perform advocacy, especially at the national level, federal level, on behalf of our local health departments. We help to promote partnerships between local public health and other entities within jurisdictions, as well as at the national level. We help to provide funding to our members and to their partners. We also provide training and education to our members and partners. We provide opportunities for networking, and we also provide resources, tools, and technical assistance, especially capacity building technical assistance. Among those resources and tools is actually one of our premier kind of offerings that we provide to local health departments and their partners, and that's the mobilizing for action through planning and partnership training that we provide through our public health infrastructure team. And through this team, we really do help local communities emphasize and address many issues. Folks often use this training for the purpose of addressing housing within their communities. And we hope that you look into perhaps utilizing MAP for that purpose as well. And with that, that's my brief introduction. And I'll just hand it off to Will.
Hi, everybody. I'm Will Dominie with BARHII, the Coalition of Health Departments in the Bay Area. And I'll tell you more about BARHII. I'll tell you more about myself and kind of the context for this training in a second. But I wanted to start with just by naming the stakes of what we're facing right now. Melanie, would you go to the next slide? So we're in a moment of, even before the pandemic, in many of our cities and towns, we're in a moment of absolutely dire housing situation where many people, many households and families were facing eviction, facing foreclosure, or otherwise struggling to pay for their housing. And as the pandemic has intensified, we have seen that risk grow much higher. So we're at a place right now where the number of people at risk of eviction now is estimated to be 30 to 40 million people. If you click next, Melanie. So that's just for context. That's the number of people in California. That's the number of people. Yeah, click again, Melanie. It's the number of people in Canada. Like that many people right now, that many households are risking being kicked out of their homes. And we'll talk in a second about what that means for health and health impacts. But I just want to start with that. This is the scale of what we're facing, and within that, we know it's primarily lower income folks, and it's Black and Brown families and families with young children that are really facing a lot of these risks. Go to the next slide. But I don't want to just stay in kind of the doom and gloom. The other part that I really want to highlight is that we know there's solutions. And towards the latter part of this webinar, I'll go through the 5 Ps of healthy housing that BARHII put out and that really guides our work on housing, and then also kind of a 4-legged stool of what do we need to be doing in this COVID moment. And we're not going to go deep into all of those policies, but at least give you kind of an overview of some of the things you might want to be thinking about as you do your work. Next slide. So just some quick logistics. I think a lot of us have gotten fairly familiar with Zoom over the pandemic, but I don't want to assume that. So welcome. This meeting is being recorded, and let us know, especially Melanie, know if that's something you're not comfortable with. There, at the bottom of your screen, you should have a place to do some reactions, and so we both encourage you to mute yourself most of the time. This will be an interactive training, so feel free to unmute yourself and speak into the room or join us in the chat. And then you can also use those reactions like a thumbs up or claps, et cetera, to express yourself throughout the training. And then next slide, the other thing we wanted to name is we'll be splitting into breakout groups later by kind of where we are in the country. And so if you could go ahead and rename yourself, and you do that by clicking on your picture and then clicking the 3 little dots and then clicking rename. If you can rename yourself with your name and then the place that you work or live, that would be really helpful as well to Melanie so she can figure out which group to put you in. Next slide. So we're going to do a number of things today. We're in the welcome and introduction section. We're going to do just a quick kind of refresher on the social determinants of health, or a quick overview of the social determinants of health and health equity. And then we're going to dive deep into the research and what we know about housing and health impacts with a focus on children and families, and then a focus also on what we know about COVID impacts as they relate to housing. And then we're going to get into solutions and successful collaborations for health with a focus on how local government, community organizations, and health agencies and health officials can collaborate to move us towards health equity and healthy housing. Next slide. So I want to just jump back a second in terms of introduction and introduce BARHII. BARHII is the Coalition of Health Departments in the Bay Area, and you can see the counties that we represent. Next slide. But I think the way that I tend to think about and that all of us tend to think about our work is actually more represented in this map here, which is life expectancy in the Bay Area. And what we know is, looking at the data and talking with our epidemiologists, is that there's about a 25-year difference in life expectancy based on the neighborhood that you live in. And just want to like pause for a second to reflect on what 25 years means. Like that's the difference between seeing your grandchild grow up or not, right? Like this, that's a statistic, and it's our lives. And so we dedicate our work to making sure that all neighborhoods, all people actually have the chance to thrive, and that we erase that 25-year difference. And next slide. We also know that COVID has layered health inequities on top of that, right? So we already had pre-existing health inequities at a massive scale. I mean, that 25-year difference, I think, should really strike into all of our hearts. And you see that kind of difference all across the country and in different cities and towns. And the pandemic has really layered and exposed, in case it wasn't clear already, on top of that, where we now see outcomes for some communities that are way worse than others. We see, want to kind of especially call attention to the hospitalization line here, where Indigenous people are, at almost a 4 times rate more likely to be hospitalized, where Black and African American folks are 3 times more likely, and Latinx or Hispanic folks are 3 times more likely to be hospitalized than other people. And you see similar things in cases and deaths. But we're really, like, if you weren't clear before about how inequities are rolling out by race and by other factors, by neighborhood, et cetera, it should be very, very clear now, and very stark. Like this to me is like a very clear marching order. We need to be taking very bold action to reverse this. Next slide. And when we think about what that action could look like, at BARHII, we popularized this framework many years ago now, but this is how we understand kind of what drives those inequities. And actually, before I explain it, I want to just take a second and see if anyone kind of in the room, if you'd be willing to unmute yourself and just throw in, like, what drives some of those inequities that we're seeing?
Inequities in equal access to housing, health, transportation.
Yeah, for sure. Anyone else?
Hi, this is Yvette with Help Me Grow. So I think something that we kind of see with the Families Calling, there's definitely a cultural component that's kind of been passed down, where they just feel that, they have what they have and they shouldn't really be asking for more. So I think more at a grassroots level, letting them know that they do have access to certain things, and they themselves are those individuals that should be advocating for their kids and for their family.
Right. Yeah. I mean, there's a lot of cultural expectations, and it goes both ways. I think some communities have been taught that they or we, do deserve everything and deserve, or not everything, but deserve to have our needs met. Sometimes at the expense of other communities. I'll take one more hand. Yeah, Katie.
Well, Suzanne Moore says digital divide.
Right.
Mm-hmm. Just wanted to remind folks, if you're in a place where you can't talk, feel free to use the chat and we will get your voices heard.
Yep. And then Anna is saying, or they have tried to advocate for themselves but have been denied appropriate by our institutions. Right. So a lot of people have very much tried to advocate. And for those of us that work in government, and I would consider myself and BARHII one of those, we haven't always done, and in fact, we've often done a fairly poor job of really listening to communities that are facing health inequities and really making transformative changes. Okay, so I want to just quickly call attention to the BARHII framework, which is how we think about this, where health and public health traditionally has been very focused on kind of the right side of this slide. So thinking about the doctor's offices, disease and injury, thinking about things like vaccines or healthy water or hand washing, all of which have taken on increased importance lately and have been very important in the history of public health. And also risk behaviors like, are we wearing seatbelts? Are we smoking? All of those are incredibly important and really shape our health outcomes. At the same time, public health over the last maybe 10 or 20 years has increasingly started to realize, and BARHII has been a part of this understanding and awakening, that actually if we're not addressing living conditions, so some of what people put out in the chat in terms of voice into the room in terms of our housing, our transportation, our access to information and internet, that really shapes our health, and that furthermore, the inequities in our institutions. So, as someone mentioned around are governments actually willing to listen to our communities, or are they not? And then our social inequities beyond that, including do our communities feel really empowered, and are they empowered to have the power to really make changes in our institutions and in our living conditions? So at BARHII, we've really understood we actually need action all along this continuum. Next slide, Melanie. And one thing just to note is that that's often thought about as health in all policies. If all of our policies actually need to be thinking about health and specifically health inequity and health equity. Next slide. The last thing I would say by way of introduction is that we're in a really particular moment where, as I mentioned, where so much is at stake around our health and around health equity. And we think this is a moment for really transformative action on housing, but also on a number of other issues. And so I included just a screenshot of our 4Rs COVID recovery plan, and there's a link there as well. And we'll share all the slides. But I encourage you to look back at this to get a sense of what are some of the other things that we really need to be thinking about in order to make sure that we come out of this pandemic actually stronger and having made much more progress on erasing some of those health inequities. And I would just note, we'll be doing more trainings and webinars with both of the other partners here that help with ACT California on the housing piece, and then with NACCHO on some of the other things that are really needed around an equitable COVID recovery. Next slide. So we're actually going to break into small groups now and spend the next a little more than 5 minutes talking about how you see housing impacting the health of children and families where you live or work, and then just who is most affected and why. And Simone's going to break you into some random groups, and then we'll see you back in a couple of minutes. And you don't have a facilitator or anything, so just work together, and yeah, we'll see you back in a couple of minutes. Welcome back, everyone. Just as a quick reminder, if you haven't already, please click on your name on your picture and just rename yourself with your name and then the community in which you live or work. So I wanted to just take a couple of minutes and hear from people. What did you talk about? What did you come up with? And feel free to chat it or unmute yourself and just speak it into the room.
I can go ahead and start. So we kind of just talked about really in high density populations where if families are having to live in, if we have a family in a 2-bedroom apartment, but there's 2 or 3 families in there, this pandemic has really kind of confined them to a certain space. So it's affected the physical development of children and then having access to actually go to a park and exercise. But it's also kind of created an added layer of this toxic stress. And now parents have to work and think about when can I go and access the kitchen? I don't want to contaminate somebody else. So you are constantly having to kind of look over your shoulder to make sure did somebody else in the household come in contact with somebody and now am I going to be at risk? And so they're confined to these really, smaller living quarters and they don't have access to that. And also because they're not going outside, it's really definitely taken a toll on their social emotional development.
Yeah, definitely. Can other folks throw in what you talked about in your groups?
I can give it.
ahead.
I can give a quick update from Group 10. First of all, we didn't quite have enough time for everybody to check in, but what we shared is that we're experiencing that an overall issue, particularly in California, with housing. One of the issues that they had with major wildfire disasters and the housing loss, that increases the issue with housing, and that the digital divide really makes it hard because people who have lost their normal social institutions of trust, like the primary care, church, and schools, particularly for people who are part of the BIPOC community, if they don't have access to some of those digital pieces, that makes it challenging to get information to people. Locally, we've also noticed that we're concerned that there is an increase in number of people who have been pushed out from their housing because we went through and did like a lot of shelter de-intensification for the individuals who needed to have shelter so that people would not be exposed to COVID. And so there was a decrease in the amount of space that was available. And even though there were like other facilities that we tried to bring online, there's a lot of concern that people are being pushed out that we aren't aware, because while there is an eviction moratoria on the books, it's not clear how many are not following that legal precedent. Somebody also mentioned that some landlords have been really clear that for people who haven't been able to pay, that they're going to take them once the moratoria expire, they'll take them back to court. They'll take them to court to pay back rent. And people who've been working with people in person, the meetings have moved to more telephonic or video. And so they've experienced a lot of challenges with people who have high adverse child experiences. And they're seeing particularly people who may be challenged with substance use disorder or mental health issues.
Yeah, so I'm hearing a number of things. I'm hearing sort of high costs in general. I'm hearing threats of eviction or losing housing. I'm hearing people actually losing housing and being unhoused, crowding, toxic stress, and then mental health issues and substance use issues. So, I think I was going to say it's a great start. It's not a great start. Those are some of the terrible health impacts that we're seeing. And we're going to take the next few minutes just to go through kind of like what are some of the things that we know from our members and from our research in terms of those kinds of connections. And I think you already all started really naming some of those main issues. So Melanie, if you go to the next slide. And then the next slide. So I'm going to just show a couple quick pictures from photo voice projects of our member health departments. So this is from the asthma program in Alameda County, where they're finding a lot of their home visiting programs are really finding that the folks that they're serving are living in really unhealthy conditions and are afraid to try to improve those conditions because they fear retaliation from their landlord, or for undocumented families, fear other kinds of retaliation or exposure. Next slide. We're seeing, this is from San Francisco Environmental Health Program. Their folks are seeing, this picture, every time I look at it, really gets to me. Just seeing families living in completely uninhabitable conditions in the cold. I think this photo is from a garage that make it really hard for children to grow and thrive, and can expose folks to ACEs and other trauma. Next slide. We're seeing, this is from San Mateo, behavioral health, and just a lot of folks on the street, and we'll talk later about some of the racial inequities in particular that we're seeing with homelessness, but as housing costs have risen, as housing's gotten more difficult to find, we're seeing more and more homelessness. And also as we've seen kind of defunding of social programs and mental and behavioral health programs. Next slide. And then this is also, I think, from San Francisco, where we know when children don't have quiet places for them, by themselves. Is that better, Melanie? Can you hear me now more? Okay, great. That there's behavioral and educational delays. And so, this is a picture from a family submitted where their kid is, doing their homework on the stairs. Next slide. So that's just what we're hearing from our members. And because of all the feedback that we heard from our members, I think 5 years ago now, we started doing some research. Melanie, can you chat the links to these two reports? This is some of the research that we published on housing stability and health. The first one is generally around displacement and gentrification, and then the second one is really focused with oversight from our maternal and child health directors on family health and outcomes for young children and families. Encourage you to check them out, and I'll give you some of the highlights right now. Next slide. So we know that housing affordability really impacts what the kind of trade-offs and choices. I mean, I don't even want to call them choices, but the trade-offs that families are forced to make. So when households, low-income households, can comfortably afford their housing, the research tells us that folks spend more on childcare, 1/3 more on healthy food, and then 5 times more on healthcare, like 5 times more on healthcare. Next slide. We also know that families with young children are twice as likely to be evicted than other families, and then once evicted, twice as likely to be in poor health. So eviction really has some pretty serious health impacts. And you could say the same thing about foreclosure or other ways that people lose their housing. Next slide. We also know that these kind of health impacts are particularly intensified for pregnant people and for young children. So the kinds of experience and stressors that we undergo in utero really shape and elevate lifetime health risks. So when people are facing unstable housing or homelessness, or I've heard a lot of stories from our folks around the counties of people like giving birth in their cars or pregnant in their cars, and we know that really can shape risks over the life course. Same thing around early childhood. I just had a kid a year ago now, and 50% of her brain development has already happened, right? And we know, I think it's in the first 5 years that 90% of brain development happens. And so the experiences we have during that period really shape our lifelong health. And housing instability during childhood, the research tells us, can yield behavioral problems, educational delays, depression, low birth weights, and other health conditions. And then finally, there's generational impacts. And we know over time that lifelong experiences and stressors actually get encoded in our genetic material, and we can pass those down. And so it's really incumbent on us, and our maternal and child health directors are very clear that if we're going to actually address kind of lifetime health, and especially the health of young children, housing needs to be at the top of that list. Next slide. We also know there's been kind of a spate of research lately around COVID and health and housing. And so I've distilled one of those studies down into a cartoon. Some of the pathways that we know of the relationship between those three things are, and people have already named this, but we see increased eviction and foreclosure, people losing their homes. We see increased homelessness, which in general dramatically raises health risks, and then in a period of pandemic, very much more does that. Same with crowding, where we're seeing, and folks have already named this, that families doubled and tripled up, where the virus, there's been some studies that have indicated that the virus travels around much more easily in those conditions. And then there's really financial consequences as well, where across the country, I think it's 70 million people was the last estimate I saw, $70 million owed in back rent as of the holidays. So there's tons and tons of debt accumulating, which can shape opportunities over lifetimes. Next slide. And then this is some particularly sobering research from Kate Leifheit and others at UCLA and I think a number of other institutions, where they quantified cumulative excess deaths based on states that had ended their COVID-related eviction moratoria. And as of publication, which was September 2020, we were already up to 10,000 excess deaths nationally from that that individual policy. So, we're talking really health impacts, and in this case, kind of the ultimate health impact of death at a really mass scale. Next slide. Sorry, I'm getting kind of depressed going through these slides. I mean, this is like these impacts are really strong, very persistent, and I think especially challenging now. And I just want to quickly highlight some of the ways in which we see this operating by race. This is some of the research that we did in that maternal and child health and housing brief, where we see in the Bay Area, African American and Latinx families are about twice as likely, and this is families with children under 5, are about just twice as likely to be unable to afford their rent. Next slide. We see similar things nationally. During the pandemic, where about 1 in 5 renters aren't caught up on rent. And again, there's similar statistics about mortgage payments or utility payments, although renters tend to be particularly hard hit. But similarly, what we're seeing is Black, Asian, and Latinx households much more likely to be unable to pay their rent because of very, very persistent racial wealth gaps that have been, existed for generations. Next slide. So this is homelessness disparities by race here in the Bay Area, and again, there's very similar numbers. Depending on where you look around the country, but we're seeing disparities for Indigenous people to be about 12 times, and for Black folks, I think it's 5 times the rates of the general population in terms of propensity to be unhoused. And again, that's the result of generations of policies and wealth gaps that have gotten us here today. Next slide. So I guess I just want to leave this section with a little bit of a call to action, which is that, we're in a time where we are, when you look at the data, we are already in a place of very clear racial inequities. And when we start layering COVID on top, they become even starker. And at the same time, we're in a period where there's massive kind of calls for racial reckoning, massive movements for that, and the inequities that, we were sometimes overlooked have been laid very, very bare, or some of us overlooked have been laid very, very bare. If we weren't aware of them already, there's no excuse now but to look them very squarely in the face. And I would argue, and I think BARHII would argue, that we're in a time where we really need to be thinking about transformative actions, like very big actions to really move us towards closing these gaps and meeting the demands for all of us of this pandemic in this moment and the housing crises that are happening in many of our towns and cities. So I'm going to stop there and just see if there's any questions, and then we'll transition. And feel free to unmute yourself or put things in the chat.
Will, this is Michael in Richmond. Are you working in Contra Costa County?
Yes.
That's great. How about the city of Richmond?
Some. I actually used to work for Contra Costa Health Services, so I haven't been as engaged in Contra Costa lately. We tend to do more regional work or county level work, but yeah, some.
Cool. Thank you.
Any other questions? And please, this is meant to be a participatory discussion. So by all means, whatever you're chewing on, put it in the chat or speak it.
Maybe if you could repeat the question, Will, for those that maybe missed that.
Oh, it's just does anyone have any questions?
Right.
Or things that you're reflecting on from the presentation so far?
Question. So as a city council member in a small city with about 11,000 people, these issues seem very vast, have taken hundreds of years to take root, and can feel overwhelming in a time and era when many of our city managers are saying that we have very limited resources, declining tax revenue, and lots of crises that are popping up like whack-a-mole, whether it's wildfire, pandemic, flooding, et cetera, or now we're in a drought. So I think having really clear, achievable pathways to move forward from a policy perspective would be very helpful, especially for those cities that have benefited and traditionally elected officials who have benefited from these structural inequities that prop up racial inequities in our communities. So I think in order to undo the hundreds of years of policy that has led us to this inequitable outcome, it's really helpful to get pieces that we can move forward on, because otherwise it feels very overwhelming, frankly.
Totally, and we'll get later in the presentation to some of the clear actions and frameworks for actions to move things forward. Because I agree, I think just saying the sky is falling and things are deeply inequitable doesn't actually move us forward. And so we'll talk later about some specific kind of recommendations and things that we might put forward. And I would say also just on the fiscal austerity part, it is a difficult time for local government. I mean, we're a coalition of local governments. And I think there's a lot of cases to be made that investing in housing protections really is a good investment. Also from a financial, I think we should do it from a moral and health standpoint, but it's also a good investment from a financial perspective in terms of cost to our EDs and our hospitals and healthcare systems and other things like that. It's really just much cheaper to have someone housed on the front end than for local government than to do all the work that it takes to really help support our health when we don't have housing. So I'll take just one last question or thought, or Katie, if you want to throw something in.
I'd chime in and say that all of our ACT projects have some youth involvement at the local level. And what we're seeing with our youth, especially with this racial reckoning that we've had this year and youth getting involved in protest and taking to the streets in terms of understanding the issues of their time, youth really recognize the housing and really the segregation of housing as one of the very first times that they realize that there are racial disparities. The neighborhood that they live in and looking around at what that looks like and the legacy of them not having stable housing, having to move a lot and going to different schools really does create a disparity that they really feel. And they really do understand this concept of if you're able to segregate people, that is the basis for disparity, is being able to separate folks. So I just wanted to share that.
Yeah, definitely, Katie. So I think we should pause for just a couple minutes for a break and come back at 11. And then we'll turn, to your point around solutions and start talking about where do we need to go based on where we are. So we will see you all back at 11. For folks that are back early, do you have any questions or things that you're thinking about?
Hi there, I put a question in the chat as well.
Oh yeah, sorry I missed that. I don't know what the normal kind of ratio of people who are behind on rent. This is much more, but I'm not sure kind of what the baseline is, but that's a good question.
Yeah, I hadn't ever seen that indicator before, so I'm just curious if that's one that is regularly collected.
I don't know. It's from the Household Pulse Survey, which is something that the census produces, and I don't know. I sort of just quickly went there and grabbed the data. I haven't looked back to see if it's an enduring data product or just something they produce for COVID. So And then I see a question, what are your housing partnerships? Do hospitals contribute dollars from their community investment, and do you work with public housing authorities? We do work with some, like we're a coalition of government agencies, of public health departments, but we do work also with medical care, and some hospitals and health plans do contribute some of their community benefits dollars, and then ideally also, and we've been encouraging them also to contribute some of their more just like investment portfolio in building housing, because it can be a good investment and actually provide housing for people. And then we haven't worked a ton with public housing authorities, but health departments have, and I'll show an example of that later. And then we don't have Orange County data. This is a response to Yvette. But the Public Health Alliance of Southern California, which is our sister organization in Southern California, does. They have excellent data. That first slide that I showed of the life expectancy inequities comes from their Healthy Places Index map, which is a great source for data in Southern California and across the state. Okay, great. So let's get started again. And Melanie, next slide. Now we're going to get into solutions. So there's two pieces to this. One around just in general housing stability, what's needed, and then we're going to get into some COVID or pandemic specific responses as well. So the first is around the 5 Ps of healthy housing. And this is the framework that we introduced, and at least in California has really been picked up, although only as the three Ps. The last 2 have been kind of left off the general conversation, but we keep bringing them back. And I think it's a really good guiding point of thinking about, we need to be thinking about all of these 5 things together in order to really make an impact on housing. We can't just do like one thing and consider our work done. It's really a suite of things. And so those things are, first, protection of renters and homeowners so they can remain in their homes, and protection of Black and brown neighborhoods to make sure that they're safe from displacement. So these are tenant protection type policies, things like just cause eviction, rent control, right to counsel, right to legal counsel in cases of eviction or foreclosure prevention programs for homeowners, that type of thing. The second is about preservation and improvement of existing homes. So this looks like, A, just improving housing habitability, right? Like, back to those pictures, those photo voice pictures. No one should be living in a garage. No one should be living in inhabitable conditions. And we need to pass policies like proactive code enforcement with anti-displacement protections that ensure that we can upgrade those units and make sure that people are healthy without kicking them out. We need to foster community ownership of housing. So this is things like land trusts or limited equity co-ops. And then also homeownership, particularly for Black and brown families. Homeownership has been the way in which many white families especially have kind of launched into the middle class. And this has really fueled some of the racial wealth gaps. So thinking about how we support homeownership for Black and brown families. The next is around production, and this is really important. It gets most of the fanfare in housing conversations, and it is really important, but it's important to be clear that it takes 5, 10, 20 years to really build a lot of housing and build enough to really make an impact on affordability. So, we need some of the other strategies in the interim. But we do really need to make sure that we're producing new homes at levels that we can actually afford, and that development is really community-centered. We have support for Black-led development and development led by the communities, whatever kind of communities that we're working in or living in. Power is one of the 2 Ps that often gets left out, and we think it's really important that the communities most impacted by housing issues and by health inequities really are in the driver's seat and have self-determination in policy making, that our policies and our movements are people-powered, and that we're building racial equity into everything that we do. And then the last P is around placement, where we really need to make sure that we are both ending exclusionary housing policies, so making sure that it's no longer okay in a wealthy suburb to not allow in affordable housing or multi-unit housing or other things like that. There's still policies on the books that are, although race neutral, really prohibit middle and working class folks from moving in. And then also just from a kind of strictly traditional public health standpoint, we also need to make sure we're not building homes next to ports, next to rail yards, next to other things like that, unless we have very, very well thought out health protections. And that in places that are already next to those things, we're helping to make sure that folks really are protected, and we're building buffers, we're mitigating some of the health impacts. I know for those of you working in Richmond, for instance, like that's a real concern, and we need to think really carefully about how we do that. So that's kind of like overall what we think needs to happen around housing stability. And then next slide, we're in a really particular moment, right, around COVID, we've been starting to popularize the idea of like a four-legged stool of what kind of policies are really important right now. So first, and these really mirror those 5 Ps, but they're a little bit reframed for this moment. So the first one is emergency protections. So we have a national level CDC moratorium with lots of holes in it. For those of us in California, we have a statewide moratorium with lots of holes in it that only covers certain types of evictions. And we really need work at the local level, and some counties or cities have already really stepped out in front of this and passed their own policies that expand those protections, in particular making sure that we have coverage for other types of evictions that are beyond just inability to pay because of the pandemic. We need to make rights real, and this is something that's often overlooked is around the implementation. And we need to be funding, investing in, contributing to community-based outreach and education, especially in the hardest hit communities. Like we often create a policy and then say, okay, we have a policy now, our work is done. And the work is really not done then. We need to really invest in making sure that people know what their rights are. A lot of people have no idea, especially in this moment where there's lots of contradicting kind of policies being passed. And it's pretty difficult to understand, like, what does the CDC moratorium mean versus a local policy? So we really need to be like helping, for those of us working in local organizations, helping our communities understand what these rights are, and then investing in things like legal counsel to make sure that people can really defend their rights. And then we need to cancel debt. I mentioned that $70 million debt figure. Low-income households in this country are facing a much slower recovery than everyone else. I've just seen some articles where lower skilled jobs are going to take a lot longer to come back. And we're going to face a massive debt crisis. And there's some federal aid coming. We're hoping for more in the next package. But a lot more work needs to be done to make sure that we're supporting families in staying out of debt and really targeting some of that aid to the folks that need it the most. And then finally, just protecting unhoused people. So there's still raids of encampments going on. We need to make sure that we're supporting kind of hygiene and other things like that, like hygiene stations, so that folks that are living in camps can do so safely and without spreading infection. And then there's been a lot of efforts to make sure that people are coming off the streets during the pandemic, and we need to make sure that when this ends, people aren't just going back out to the streets, and that there's options to stay indoors, and then also that we're investing new resources in racial equity as well whenever we're considering new funding sources. Next slide, Melanie. Just want to quickly touch on a couple successful collaborations of like, how do we actually make those things real? Next slide. We think at BARHII we need collaboratives of community-based organizations to really organize for change, public health officials and agencies to provide the case making, the data to help us understand where we need to target, and then local government to really play a role in developing and implementing policies. Next slide. So I want to highlight just like 2 examples of that. And actually, next slide. So this is one from Boston, and to the question earlier about like, do we work with housing agencies? And this is a really great example of the Healthy Start initiative, where the Boston Public Health Commission home visiting program started seeing amongst their clients a lot of ways in which housing insecurity was impacting healthy births or producing unhealthy births. So they sought out a collaboration with the housing authority, and they created a program where public housing, a certain number of public housing units are really prioritized for pregnant people at risk of poor birth outcomes that might then lead to a cascade of other health impacts throughout their lives. So this is like an example of just like collaborative projects where we target a specific group in order to improve health over the life course. Next slide. One of the others closer to home for us is in Vallejo, where the health department and BARHII actually participated in this as well, really helped document housing and health needs, especially in one of the few places in our region that has an actively growing Black population. Most other parts of the region are seeing mass displacement. And then health organizations help support a new community organizing group, the Vallejo Housing Justice Collective, which both fought for one of the strongest local eviction moratorias around during the pandemic, and then also is launching a land trust and is, I think, trying to buy their first 16 properties in the next little period. Next slide. So I'm going to stop there and just turn to some implementation. And Melanie is going to break you out into groups by region. So you'll be put with people who are kind of like the closest people towards you, to you geographically. And we want you to talk about 3 questions. And Melanie, if you could put those in the chat. What responses are you seeing where you live or work? What's needed to undo the racial inequities? And then what roles are you playing or can you play? So enjoy your groups, and we'll call you back 5 to 11:30 for a little debrief and close. All right, it looks like everyone's back and joining us. We wanted to take just a couple minutes for you to both type, and then if anyone wants to share kind of what came up in your groups, and if there's anything else that you'd like to kind of share out to the larger group about the responses that are either needed or that you've already seen where you're working. Anyone want to throw something in?
I will, Michael, in Richmond. So our city council is right now going to be voting on where to have a safe parking spot, a trial 1-year pilot program. There is some money. There's about $500,000 between 2 sources for safe parking. And so that's something that they're working on, and it should happen within the next month or 2. They will have decided on the spot. Now, it could be as few as 30, or if they pick Hilltop Mall, it could be 100. Don't know what's going to happen.
Great. That's awesome. And for folks that don't know, safe parking is usually a place that people who are unhoused can park their cars overnight and sleep there. And then I see a chat from Mitch about their group was talking about the digital divide and how hard it is to get information about eviction protection to people that don't have the internet access or computers, and that's very much true. Anyone else?
I'm from the same group, and one of the things that I found is getting information out. There's a lot of violence going on. they're doing great jobs with Project Room Key and that sort of thing, those who are able to do it. But getting the information to the actual people that need it, I seem to see a consistency throughout all of the counties that seems to be happening, that people are leaving because of fear and not an inaccurate information. There is no legal assistance. And I was at a meeting and they were talking about utilizing paralegals and law students. And I think that that would be a brilliant idea, to set up clinics in these specific areas to actually communicate and use technology as a translator for those where they don't have someone to translate. I think that that's something that's really important to actually get to the people that are in need.
Yeah, thank you, Arlene. Okay, Melanie, would you put the evaluation link in the chat? We're going to start to close, and we really do use these evaluations, so please click on that and start filling it out. And then Katie, I think, has some parting words for us.
I do. First of all, thanks for joining us. This was great. It was really nice to hear some of your comments. And I just wanted to remind folks that we would like to talk to you if you want to explore being part of our All Children Thrive project. We're happy to just have a conversation about what that looks like, if you're just expressing some initial interest, or if you have a city working on policy in mind, we'd love to hear about it. I'm going to go ahead and say, just drop your name and email in the chat and I will reach out to you. Simple enough. We're going to send out a follow-up email. So if you were registered for this session, everybody who came will get that, followed by sort of an overview of All Children Thrive and some of our programs. BARHII, I'm sure, will send some information about what they're working on in HO2. If you're interested in some of the slides, I'm happy to share my All Children Thrive slides. So thanks for being with us today. All Children Thrive is conducting a number of these educational forums, and we are going to have BARHII back. And so we'd love for you guys to come to part 2, and we can definitely cover a little bit more in depth some of the issues that we discussed today. So the educational forums, again, will be hosted by All Children Thrive, and we'll have other topics as well, but BARHII definitely. Thanks a lot, Will, for your work on this.
Yes, of course, Katie. And then just also stay tuned. NACCHO also has a continuing kind of COVID health equity series as well, so look out for that. And thank you so much for spending your morning with us. Feel free to reach out if you have questions, and it was really good to see you all.
Wonderful.
See you later.
Thanks, guys.